Twice a day, at your bathroom sink, in under 60 seconds. There's a habit that might be canceling out one of the best studied blood pressure benefits in your entire diet. I won't tell you what it is yet, but there's a vegetable tangled up in this too, and the connection between the two is stranger than you'd guess. I'm Mike Anderson. This is Inside Health, where we skip the guesswork and go straight to what the research says. Stay with me. This starts somewhere you wouldn't expect: your mouth, the pharmacy counter. You've done the walking, the low-salt meals, taken the pill every single morning, and the pharmacist reads your number back to you, and it's still a little high. There's a particular kind of tired in that moment, not physical. The tired of doing everything right and still not getting the result you were promised. You didn't fail. Your blood vessels are supposed to relax and widen with every heartbeat, like a hose flexing open. A molecule called nitric oxide tells them to do that, and your body makes less of it every year you're alive. Not something you did, just time. So here's the real question underneath it. If your body's making less on its own, is there another way in? It started on a running track, not in a hospital. Cyclists drinking concentrated beetroot juice before races seemed to use oxygen more efficiently. That oddity is what led researchers to ask whether the same compound could affect blood vessels at rest, sitting still, on an ordinary Tuesday. Beetroot carries something called dietary nitrate. On its own, it doesn't do much. But bacteria on the surface of your tongue, right now, while you're listening, convert it into nitrite. Your body converts some of that into nitric oxide, the same molecule that fades with age. A study confirmed this pathway directly. Give people concentrated beetroot juice, and within about 3 hours, blood pressure measurably drops. The effect is real. Webb and colleagues found an average drop of roughly 10 points systolic after a single dose, which is a genuinely large acute effect for something this ordinary. But here's what that same research made clear. Almost as a side note, the whole thing depends entirely on bacteria living on your tongue, converting that nitrate into nitrite in the first place. No bacteria, no conversion, no nitric oxide, no effect, no matter how much beetroot juice you drink. Guess what that means? If something in your daily routine could reduce or wipe out those bacteria, this entire mechanism could be shut off before it even starts. Regardless of what you eat, something that ordinary exists, and it's not in your kitchen. That's the setup. Here's the specific everyday thing that can do exactly that, and it's sitting in your bathroom right now. Same morning, coffee's done. You go brush your teeth, and out of habit, you rinse. The strong kind, the one that burns a little, sitting under the sink for years because it kills 99% of germs. Here's what that might be doing. The whole nitrate to nitric oxide pathway runs through bacteria on your tongue. Kill those bacteria, and you shut the mechanism down before it starts. Antiseptic mouthwash, specifically the chlorhexidine kind, does exactly that. A study found it blocks the nitrate to nitrite conversion almost entirely and takes most of the blood pressure benefit down with it. So someone could be doing everything right, eating the beetroot, drinking the juice, and canceling it out twice a day without knowing it. It's not on the label. Your dentist isn't thinking about your blood pressure. Your doctor isn't thinking about your mouthwash. That's thing two. Something this ordinary can turn the whole mechanism off. One thing down. The second one isn't about your biology at all. It's about you. Quick honest timeline before the second thing, because people usually want to know this. A single dose measurably lowers blood pressure within about 3 hours, but the more meaningful, sustained effect, in daily use, in older adults specifically, took 3 weeks to show up in one well-known trial, and it was measured through daily home blood pressure checks, not a single clinic reading. So, a real shift within hours, and a bigger, more dependable one that takes about 3 weeks of daily consistency to build, not instant, not nothing. This is the part that separates a research video from a sales pitch, and it's the one most videos on this topic skip entirely. Here's something the same trial found that rarely gets mentioned. Once people stopped drinking the juice, the benefit didn't linger. Within about a week off it, blood pressure measurements went back to where they started. This isn't a one-time fix. It only works as long as you keep doing it. What that means practically: 3 weeks is long enough that a lot of people give up before they ever see the result the research actually showed. Picture someone specific, not a real patient, an honest composite of what the research suggests. A woman in her late 60s who tried concentrated beetroot juice for about 5 days, didn't notice anything dramatic, and quietly stopped. Nothing wrong with her decision. 5 days was never going to be enough to know either way. If that's you, or something close to it, you didn't do anything wrong. 3 weeks doesn't feel like a small ask until you know that's actually the marker the research is built around. And now you do. One more limit, quickly. A few smaller trials on brain blood flow and memory in older adults came back mixed. Nothing like the clarity of the blood pressure finding. If a video tells you this sharpens your memory, that claim stands on thinner ground than the one we just walked through. Both things laid out, what's happening in your mouth, and whether you actually give it enough time. Here's what to do with that. Concentrated nitrate-rich beetroot juice daily is what the strongest trials used. Don't like the taste? Plenty of people don't. The researchers themselves point to spinach, arugula, celery, fennel, and kale instead. Never a beet juice or nothing situation. Use antiseptic mouthwash regularly, check whether it's the chlorhexidine kind, and mention it to your dentist or doctor next time you're already in the chair. The one sentence that matters most. This doesn't replace prescribed blood pressure medication. If you're on it, raise this with your doctor as a possible addition. Never a swap. Readings consistently high, or chest pain, severe headaches, shortness of breath, that's not a food question anymore. Call your doctor today. So, honestly, are you someone who'd actually stick with something for 3 weeks before deciding if it works? Or do you usually know within a few days whether you're going to keep going? No judgment either way. Comment. Which one? I'm genuinely curious how common the second one is. Picture 3 weeks from now. Same morning. Coffee not made yet. Cuff on your arm. That same second of waiting. Except now you know the two things that actually decide what that number does. What's happening in your mouth twice a day, and whether you give it the 3 weeks it actually needs before deciding it doesn't work. It's not instant. It's not universal. And it comes with one strange, avoidable catch involving your mouthwash. But your blood vessels aren't on some fixed, one-way decline. The same pathway that worked effortlessly at 25 is still there at 75. It just needs a little more support. A beetroot, or a handful of spinach, is one well-studied way to give it that. It started in your mouth. It ends there too. If this is the kind of health content you want, real studies, explained clearly, no hype, sources always listed, subscribe, and turn on notifications. Next time, what your sleep is quietly doing to your heart every single night.